Hello, everyone. My name is Brad Freitas. I'll be discussing hepatitis C under the four-step risk assessment process. The history and discovery of hepatitis C. Hepatitis C was founded in 1989 by scientists at the CDC. Three strains were now discovered called hepatitis A, B, and C, each having its own way of transmission. Hepatitis C virus is commonly known today as HCV, which will be called that for the remainder of this presentation. It is also a common cause of liver damage. The disease. The definition of a disease is a disorder of structure or function in a human, animal, or plant, especially one that produces specific signs or symptoms or that affects a specific location and is not a direct result of physical injury. HCV is common in the U.S. with more than 200,000 cases every year. Hazard identification. Symptoms for HCV include fever, fatigue, decreased appetite, nausea, vomiting, abdominal pain, dark urine, gray-colored feces, joint pain, and jaundice, which is yellowing of the eyes and skin. Majority of subjects who recently contracted HCV do not show any symptoms whatsoever. However, problems may occur if left untreated or undiagnosed, which will result in liver damage, liver failure, liver cancer, and possibly death. Here is a picture of a healthy liver on the left and an infected liver on the right by HCV. Notice the difference in skin color and the inflammation caused by the infection. Dose response. Contracting HCV is mainly by blood transfusion, sharing needles, and organ transplants. Over 30,000 acute cases with none to minor symptoms are reported each year. However, with chronic cases, it is a different story with a total of 2.7 to 3.9 million chronic cases in total, which counts for 75 to 85% of people who are diagnosed with HCV. Also, the majority of citizens across the country and possibly the world may not even know they have HCV. Treatment. Treatment for HCV is by antibiotics, which are prescribed by a doctor. However, the symptoms may not even subside for a few months or even up to a year. There are several types of antibiotics, but here are some for chronic HCV. A brand called Cobegas has a drug ribavirin and combined with Pegasus or Referin can treat chronic HCV. It is also used for compensated liver disease. Other drugs that treat chronic HCV include Infergan, Intron A, and Rebidol. Exposure. Conditions are a factor to contracting HCV. This mainly is a result by low-income areas and the uneducated. This also may lead to more diseases or infections that can cause even more serious problems. If the person is currently or ever injected drugs even one time, has an increased risk of catching HCV. Other ways include through organ transplants/transfusion due to an infected person that passes on the virus. Overall, these types of subjects are recommended to take HCV tests. You should call your doctor if you were born between 1954 and 1965, ever used needles, snorted, or shared drug paraphernalia, had sex with 10 or more people in your lifetime, received blood transfusion, blood product, or organ transplants before 1992, or are HIV positive. Baby boomers have a greater risk of having HCV. Here are some examples of how HCV spread through person to person. Risk. HCV needs to be treated immediately if any symptoms occur or if you think you have it. Baby boomers are susceptible of having HCV since there was a lack of advanced medicine and technology at that time period. There is also a risk when a patient has to filter blood through a machine called a hemodialysis, which filters toxins out and filter new blood into the body. The risk here is that when a patient who is positive for HCV uses the machine and is not properly cleaned, results passing it on to other subjects. Doctors and nurses are also a risk factor since they may accidentally poke themselves with a dirty needle. HIV-positive patients are also at risk since the white blood cells in the body do not work properly in the blood. Also, pregnant mothers who have the virus will ultimately infect the baby once he or she is born. Is it cancerous? Yes, it is cancerous. However, only less than 5% of patients do get liver cancer, compared to alcohol, which is the main source of liver cancer. Thank you for watching and listening to my presentation. I hope each and every one of you listened and learned something about hepatitis C, and I hope you have a safe and wonderful day. Thank you.